السلام عليكم. هل تعلم أن استرواح الصدر الضاغط قد يؤدي إلى الموت في دقائق معدودة؟ فهي حالة طبية طارئة تجعل الرئة تنهار وتضغط على القلب والأوعية الدموية. في هذا الفيديو سنكتشف ما هي وكيف نشخصها وماذا نفعل لإنقاذ حياة المريض. شكرا لكم.
Everyone, welcome to my channel. I'm here to talk about TensionPneumothorax, which is a life-threatening condition where it gets into the pleural space and can't get out. It causes the lung to collapse and puts pressure on the heart and great vessels, causing a number of potentially fatal complications. So let's talk about what it is, what causes it, and how we diagnose it. First, let's talk about the causes. There are three main categories. The first is traumatic, usually a penetrating chest trauma like a stab wound or gunshot. On chest X-ray, there are both direct and tension signs. The main one is a mediastinal shift. You'll see the mediastinum shifting away from the affected side, meaning the heart and great vessels are being pushed to the opposite side. You may also see a depressed hemidiaphragm on the affected side because the lung is collapsing and pushing upwards. The other thing you may see is widened intercostal spaces, which indicates that the lung is trying to expand but can't because of the trapped air in the pleural space. You may also see a flattened or inverted diaphragm, again due to the pressure from the air in the pleural space. And finally, late in the presentation, you may see compression of the contralateral lung. You may also see a distended superior vena cava or even a heart that looks larger than usual, indicating that it's being compressed. The direct signs are findings that are directly related to the pneumothorax itself. So in a simple pneumothorax, you'll see absent lung markings in the peripheral area, meaning that the lung has essentially been replaced by air, which is why we call it a tension pneumothorax. You'll also see the collapsed lung. If you look near the hilum, it'll be visible as a dense area because the lung is no longer aerated. You may also see a visible pleural line, which is the edge of the lung, but blunt trauma can also cause this if there is enough force to rupture the alveoli and create a tear in the pleura. Also, rib fractures that puncture the lung or bronchus can cause this. So that's category 1, traumatic. Category 2 is iatrogenic, meaning it's caused by a medical procedure. This can happen with mechanical ventilation, especially if the pressure is too high. It can happen with central line placement, thoracentesis, and even CPR can cause this sometimes. And we'll talk about that in the video that goes along with this. Primary spontaneous pneumothorax happens in young, tall males usually due to rupture of subpleural blebs. And then category 3 is spontaneous, and we'll talk more about blebs in the lung video. Secondary spontaneous pneumothorax happens in patients who already have some sort of lung disease. In COPD, for example, it's due to ruptured bulli, and in HIV patients, it can be due to pneumocystis pneumonia. In cystic fibrosis, it can be due to a number of different things. In patients with TB, it can be due to cavitation from the bacteria. So those are the three main categories of causes. Let's move on to the radiological signs. The diagnosis is often made clinically and then confirmed later with imaging. The tension signs are the findings that indicate that the patient is in respiratory distress and it is a life-threatening emergency. These include a number of things. It is important to note that this is a clinical emergency and you shouldn't wait for imaging if the patient is showing signs of shock. Thanks for watching. Take care.